COVID-19 is on everyone's mind. Even the most careful and prepared families can contract the novel coronavirus. Most people will recover safely at home, but some people will get sicker and require medical attention. Our team of specialists has cared for hundreds of COVID-19 patients, and in this video I'm going to tell you what you can expect if you contract COVID-19, how to care for and monitor yourself at home using the equipment in the MD Life Kit, and how to tell when you need to seek medical care at a hospital or ER. First, what can you expect if you contract the virus? The symptoms vary a lot from person to person, especially during the early days. In the first phase, which lasts 8 to 12 days, you can have fever, cough, sore throat, diarrhea, headaches, nausea, fatigue, basically the same symptoms as influenza or a stomach bug. Some people barely have any symptoms at all, while other people feel like they're hit by a truck. Loss of taste or smell is very specific to COVID-19. After that first phase, about 4 out of 5 people start to recover, although it can take a while. Hopefully you'll be one of them, and taking basic medications for pain and fever, like the acetaminophen and ibuprofen included in your MD Life Kit, will be enough to get you through. We will cover the longer-term recovery from COVID-19 in a separate video. About 1 out of 5 people, however, proceed on to a second phase, where they do wind up getting sicker and often needing to go to the hospital. People who are younger and healthier have this happen less often, while people who are older, who have medical problems like diabetes, high blood pressure, obesity, heart disease, and immune problems are at higher risk. Strangely, asthma and other lung diseases don't seem to significantly increase people's risk of getting sick, while diseases of the heart and blood vessels are much more important and relevant for COVID-19. Practically, there are 2 really important things you need to know. When do you need to go to the doctor and seek medical care? And what are the things that you can do to take care of yourself at home so that you don't have to do that? Think about going to the ER for COVID-19 the same way you think about going to the ER for anything else. If you have chest pain, feel like you really can't breathe, are confused, feeling so weak like you might pass out, or anything else that seems really out of the ordinary or dangerous, go to the ER. Get help right away. If your symptoms are things that you would ordinarily manage at home, keep doing that. Although if you have some of the medical problems mentioned above, it would be a good idea to get in touch with your doctor. The most common reason people have to go to the hospital for COVID-19 is trouble breathing and low oxygen. The virus tends to like the lungs the best, but has been known to attack any organ systems. Keeping your lungs open and expanded is the biggest thing you can do for yourself. Be up and walking as much as possible. When you are lying down, switch positions often. In the hospital, we have people switch back and forth between lying on their backs, sides, and stomach to protect their lungs. And it's a good idea for you to do this at home as well, so hopefully you won't need to go into the hospital. Many people find that focused breathing exercises make a huge difference in how they feel. The incentive spirometer in your MD Life Kit is the same one that's used in hospitals and pulmonary rehab. It forces you to take the sort of slow, deep breaths that strengthen your lung muscles and prevent the tiny sacs in your lungs from collapsing. Do 8 to 10 repetitions 2 or 3 times a day. The other part of the MD Life Kit that's absolutely essential for COVID-19 is the pulse oximeter. This little device is the only way to really know what your oxygen levels are in COVID-19, which is absolutely essential. Normal oxygen levels are between 93 and 100%. If your oxygen levels dip below that, you need to go to the hospital. But COVID-19 is a sneaky disease. You can have dangerously low oxygen levels before you really feel sick, so you need to check your oxygen levels twice a day. Check out our other videos for detailed instructions on the incentive spirometer and pulse oximeter, how they work and how you use them.